had various specialists, obstetrician, gynecologists, general surgeon, and co. Currently, all have left, and their return cannot be guaranteed because of the situation that we find ourselves. Again, health workers have had to, like you heard from the district's municipal chief executive, have had to work under very dangerous conditions in the sense that going to and from work is always a risky venture, even though we have not heard that any health worker in particular has been attacked, harmed in any way. There's always a risk because gunfires are crisscrossing. They get back home. You hear the guns ringing as though it is just in your room or behind your room. And if you are not properly tagged and you left your name tag, you are not sure what can happen to you, even though the security agencies are doing their best to facilitate their move to and fro from work. And so it's a very tense situation over there, and the health workers are working under very trying conditions.
Well, I don't know about the security for your members there. Have they had any form of protection for them to do their work?
Well, like I said, there is some security reinforcements at the facilities. And we have heard from our colleagues on the ground that, for example, Bawku Presby has always had some military presence or police presence at the facility trying to help to screen people and also protect people. We are aware that the municipal authorities also facilitating some protection for our members and others, the other staff, nurses, and the other staff that work in the facilities. However, like we said, you can't have police going to the residences of these people. And for example, if they are traveling out of the town, you can't have them being escorted to every single place that they are going. And so there's that risk that exists at all times.
Right. And how about healthcare delivery currently? You tell me that there's only one doctor serving the Bawku community. Are they able to, progress with their work? Do they have nurses with them? Because recently the nurses are also crying out for evacuation out of the place. How will you describe healthcare in the area?
Like I said, there's only one doctor serving the largest hospital in the Bawku municipality, and that is the Bawku Presby Hospital. At its peak, you had various specialists present in the facility with supporting staff and the relevant other staff that needs to do the work that they do. There was a general surgeon, an obstetrician, gynecologist, etc. Now all of them are no more there. And it is only one officer who is serving all these people. Clearly, he will be overwhelmed. And so there are many cases that could have been done in Bawku, but need to be referred out of the facility because he's clearly overwhelmed. Again, working staff are also leaving, being caught in this very unfortunate situation where it is unsafe for them to work. You have the nurses, you have other key staff who are leaving the area. And so making it difficult for the doctor to even execute his work. The other two doctors, one retired and another person, they are in the private facilities, and one, I think, is in Binduri Health Center. However, Binduri was quite close to the recent action, and so that place was shut down. And so if you think about it, healthcare has been seriously curtailed with the risk to people who sustain injuries and other just regular ailments going to the facilities, either having to stay in longer queues or having to be referred to faraway centers to get the care that they need.
Are you in talks with the Ministry of Health, at least some form of help for the situation for your members as well? Has there been any communication with the ministry on this?
Well, we are constantly engaging, and we have engaged the various authorities all the way down to the district level. And like we said, there is good collaboration on the ground. The regional authorities are engaging our members. The district authorities are engaging the doctors and the other health staff on the ground. However, like we said, there is no safety in a war zone. as much as you do your best, there's no safety. And that is why we will appeal to the warring factions that they should look at what is happening to their own health facility, to their own people who have to now spend a lot more going to faraway centers in Tamale, in Kumasi, and other places, or Bolga. And the fact that health workers feel unsafe. And if they continue the path, it may get to a point where most health workers will totally leave the place for them, and they may not get the care that they require when they even get injured and all that. We continue to appeal to them to keep health workers away from whatever situation there is. And at least now that we've not had any health worker being directly injured as a result of this, but we pray that this continues and they find peace so that we can return to normal. Bawku Hospital, for example, Presby was a place where we had house officers going for training, we had nurses going for rotation, we had various surgeries being performed in those places. Now, most of those things are gone and are limited. And this even affects the communities themselves because they have to spend a lot more to transfer these patients and a lot more to go to faraway centers to have the care that they desire. So this is what we are doing. We also, by ourselves and our divisional chairman and the executives, are also trying to provide some support, at least some emotional support to our members, and at least in the situation in which they find themselves.
Well, I'll stay a while longer on the last point that you just made, that you know, the healthcare delivery is being challenged. We have just one doctor there. I'm wondering whether that doctor is also bent on leaving anytime soon, or he is trying to, you know, stay up with the situation and then go ahead to, you know, for the sake of mercy, attend to injured persons and those who are sick.
Well, this doctor, as I speak, has expressed his desire to stay there as long as he is safe. Of course, you have to live to let live. And so at any time that he feels threatened, we will not hesitate to ensure that he's evacuated from the place. Because if he is not alive or he is harmed, he cannot even provide the services that he's sworn to provide. And so for us, he has expressed his desire to continue serving until he feels unsafe. And so we'll continue to support him. But then once the place is unsafe, he ever feels unsafe at any moment, we will definitely ensure that he's evacuated from the place.
All right.
Let me reiterate that beyond the Bawku township itself, this is escalating to the adjoining districts. It's not about just Bawku itself, as you've heard from the discussion. This is fanning out into other areas.
Yes, Nalerugu and the rest.
And so we think that it's important that government intervenes quickly, the leaders and the traditional authorities intervene quickly and bring peace